I'm Dr. Rohini Paul. It is about nursing skill tip. Today I want to talk to you about intercostal drainage. So I'm not going to go in detail what is intercostal, all that. Why there is water in this drainage bottle. That's all I'm going to tell you. Because many of our nurses working in cardiothoracic ICU for 3 years, 4 years, they fix it every day. They connect it, they empty, they measure, they document, but they have no clue why there is water sitting in that bottle. So that is all I'm going to tell you now. So the only reason being why, because the atmospheric pressure is much higher than the pleural phase. The pleural phase it is surrounding the lung, both the lungs. That is called the pleural phase. The pleural phase, there is a pressure. Around the heart, there is a pressure, intracardial pressure. So when the pressure inside is going to be high, then your lung can never expand, and this is what your breathing we talk about. So atmospheric pressure is very high, and I want the fluid or air which is around the lung to be drained out. How do I do it? I don't want this because always the higher pressure will go get into the lower pressure area. That is the scientific reasons it will come. So I want this drain also to be emptied from my pleural space, and I don't want anything to be hurting my pleural space. So how do I do it? This is the reason. The tube which is coming out of the pleural space is immersed into a water. That is what you say, single bottle, 2 bottle, 3 bottle. It is immersed fully. If you see the picture, you will understand better. It is immersed. What is connected with the patient is immersed fully into the water, so that the atmosphere pressure will come just over the water. It can never go into the tube and reaches the patient pleural space. So that's the only reason. So as a nurse, why do we use water in the drainage bottle for the intercostal drainage or pleural drainage? We have to say the pleural space is much lower than the atmospheric pressure. That much if you could answer, I'm sure you will understand better things. So with that, I conclude. And you don't need to worry how much the pressure difference and all that. Then the only reason, that's the reason, when accidentally the tube is removed, as a nurse, what you need to do, take a sterile pad, just put a pressure over it till you get the medical help. That is all. The reason is you will not allow the atmospheric pressure entering into the pleural space, so that lung will not collapse accidentally and it will not harm your patient. Thank you very much.